I am Dr. Krishnan speaking out here. Few concepts which are helpful for our ICU nurses to manage the cardiac patients in our unit. First, initially, I will tell you the things which will help you how to receive the patient to our unit. Before receiving, you should have prior information about the diagnosis and the surgery performed. It may be a CABG with or without IABP. So it makes a lot of difference the patient is on IABP or not an IABP. Or it may be a mitral valve replacement or repair, or a aortic valve replacement or a double valve replacement. It may be a vascular case or a pediatric case. So by knowing these things, we can prepare ourselves how to receive the patient to our unit. There are other things which I am going to tell you. Some patient, like patient who is on IABP or patient who might be ventilated for longer durations, prolonged ventilation patients. They require a air mattress. So you should be prepared with the air mattress. You should set the bed with air mattress. Some patients whose creatinine is elevated, more than 2, they might be dialyzed in the unit. So you should take that patient in bed number 4, which has the place where patient can be dialyzed. You should be prepared with sedation drugs. Some patients who are supposed to be ventilated for longer duration should have the sedation drugs in hand. Some patients, they may bleed more. So, if expected drainage is expected chest drain, expected chest drain is supposed to be more, you should be prepared with blood and blood products of that patient. Some patients might be pacing dependent. You should have pacing box in hand and other equipments for pacing. You should be prepared with all those things before receiving a patient to the unit. Next, how to receive the patient. The procedure, how to receive the patient. Once you get the patient to the unit, first step you should do is connect to ventilator. With the desired settings, which I will be telling later. connect the filter, HME filter at patient end and at the machine end, that is the ventilator, in the expirator limb. This is to prevent the respiratory infections. And this HME is supposed to prevent infections. Next step is, after connecting to the ventilator, connect the transducer. Zeroing should be done and note the ABP. Third thing, connect the ECG, later on the SpO2 probe, connect the CVP. After those things, place the chest drains and connect the slow section. After connecting, you should follow these chest drains, milk the tubes, chest tubes every 15 minutes. And note the chest drainage. Never forget to connect the power cords to all the syringe pumps. After these things, you should make the bed elevated position 30 to 45 degrees, proper position, so that it will aid chest drainage